I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Let's try to understand what freezing is in IVF. When we talk about IVF treatment, we also talk about freezing. What is this? Well, basically it's not just during IVF, we can do it before also when it comes to sperm. So there are three types of freezing. One is sperm freezing, second is egg freezing, and the third is embryo freezing. All have different reasons to be advised for a patient. So we look at the sperm freezing factors first. Well, to begin with, there are samples that are very poor in quality, and to be able to assure that on the day of IVF when the eggs are removed, we have some sperms to work with when we're trying to fertilize the egg, we freeze something called as a backup sample. Suppose the sample is very poor, only 1 or 2 sperms per ejaculate is what we are getting, we try to freeze 3 or 4 samples so that on the day of egg collection, we have backup samples so that we are not disappointed with having no sperms on that day. So that's called a backup freezing. Next is, suppose the husband is traveling, suppose he is abroad, he wants to leave the wife here for treatment, and for months this is going on because IVF or any other treatment in fertility is a time consuming treatment protocol. So if he leaves wife here, he can always freeze his sperms as a backup, and we could use it for IVF or IUI as the patient wishes. So that's another factor. Third one is when a male patient is going through some form of cancer, it could be testicular, blood or anything, and they're going for chemo or radiation, they would like to freeze a sample because chemo radiation are harmful for sperms, and there could be a high possibility that you will be left with no sperms after this treatment. In such instances also, sperms are frozen, and when the patient returns after treatment, these sperms can also be used for IVF. So it's a very good protocol for cancer patients who want to have children after they are done with treatment. So that's another cause. There is another reason why we freeze sperms. It is called as testicular sperm freezing. When we take out sperms from testis, we freeze sperms so that we can use it on the day of IVF. This is a procedure which need not be done each time, so sperms can be removed and frozen. That's another cause of sperm freezing. These important factors are for sperm freezing. Let's talk about when we do egg freezing. Egg freezing is a very simple procedure now. After decades of research and development, scientists are now able to freeze it with 100% survival rates. There are some reasons why we do egg freezing. The first is a very simple reason, but these are reasons that we encounter in our labs. Suppose the eggs have been retrieved, and on that day the husband is not able to give us a sample and he is not frozen a backup sample. In such instances, eggs are frozen. We wait for a sample to be given, and we can thaw the eggs and utilize both of them, the sperms and the eggs, and fertilize the eggs and make embryos. So that's one cause. Second is when a female is going for cancer treatment, when she is expecting chemotherapy and radiation and wants to freeze her eggs, because as I said, chemo and radiation can be harmful for eggs and sperms. These eggs can be frozen, and after chemo radiation, if the woman wants to have a child, she can definitely come back and use her eggs for a pregnancy. The third is social reasons. Well, a lot of women are now wanting to freeze their eggs in the name of education or career, or wanting to delay pregnancy due to financial conditions. Whatever the reason is, there are a number of companies also now promoting egg freezing. So women now are allowed to freeze their eggs and use them maybe years later so that they can plan their pregnancy properly. So these are social reasons we freeze the eggs for. The third part in freezing is embryo freezing. When do we do embryo freezing? When you have given us too many eggs and we have made too many embryos, at that moment we cannot put all the embryos back into your uterus. We can put 1 or 2. The rest of the embryos, which are good in quality, need not be discarded. We freeze them. And these embryos can be used for 2 instances. One, your previous cycle failed, you did not get pregnant. You can come back for these frozen ones, have them removed, have them thawed, and you can get them transferred into your uterus. Or you could have fallen pregnant, you wanted to get pregnant again years later, you can come back for these embryos and have them transferred into your uterus for the next child. So this is a very, very simple procedure. The second cause is when you have given us 2 eggs really, and you have gone into something called as ovarian hyperstimulation. At such instance, the embryo should not be transferred back into your uterus because there are detrimental effects to your health, and it's not advisable in such cases, especially when the OHS, ovarian hyperstimulation, is very severe. At that moment, we freeze embryos so that we can use them in a subsequent cycle, which is next month or whichever month you are comfortable. We can remove the embryos and transfer them back into your uterus. So these are instances where we freeze embryos. If you want to understand more, if you want to freeze any of them, sperms or eggs, you want to understand more, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.